Hello and welcome. Today, we're diving into a condition that affects many people, particularly women: urethral syndrome. It's a complex and often frustrating issue, so let's explore what it is, what causes it, and how it's managed. The exact causes of urethral syndrome are still debated, making it a bit of a puzzle. Unlike a typical urinary tract infection, there's usually no detectable bacterial infection present in the urine. However, potential contributing factors include inflammation of the urethra, possibly due to chemical irritants like soaps or spermicides, muscular tension in the pelvic floor, prior urinary tract infections that might have caused long-term changes, and even nerve irritation or sensitivity in the area. Some researchers also suggest a possible link with hormonal imbalances or autoimmune factors. While we don't fully understand the mechanisms behind urethral syndrome, the prevailing theory focuses on chronic inflammation and hypersensitivity of the urethra. This inflammation can lead to increased sensitivity to stimuli, triggering the urge to urinate frequently and causing pain or discomfort in the urethra and surrounding areas. The lack of identifiable infection doesn't mean there's no biological process at play. It simply points to a non-infectious inflammatory or neurological component. Urethral syndrome is most commonly diagnosed in women, particularly those in their reproductive years, although it can occur in men as well, albeit less frequently. Due to the non-specific nature of the symptoms and the absence of a clear diagnostic marker, the exact prevalence of the syndrome is challenging to determine. Studies have suggested that it may account for a significant portion of women who present with urinary symptoms but without a confirmed bacterial infection. The symptoms of urethral syndrome can mimic those of a urinary tract infection, but without the bacteria. Common symptoms include frequent urination, an urgent need to urinate, pain or burning during urination, pain in the lower abdomen or pelvic area, and a feeling of incomplete bladder emptying. Some individuals may also experience pain during or after sexual intercourse. Diagnosing urethral syndrome can be tricky because the symptoms are similar to other conditions. A thorough medical history and physical examination are crucial. Urine tests are performed to rule out a bacterial infection if the urine cultures are negative but the symptoms persist. Further investigations might include cystoscopy, a procedure where a small camera is used to visualize the inside of the bladder and urethra. In some cases, aerodynamic testing may be performed to assess bladder function and rule out other conditions like interstitial cystitis or overactive bladder. Urethral syndrome isn't typically classified into distinct types, but rather considered a spectrum of symptoms with varying underlying causes and presentations. Some individuals may experience predominantly pain, while others have a greater focus on urinary frequency and urgency. The underlying cause, such as pelvic floor dysfunction or chemical sensitivity, might influence the symptom profile. Treatment for urethral syndrome is often multifaceted and aimed at managing the symptoms. This can include lifestyle modifications, such as avoiding bladder irritants like caffeine and alcohol, drinking plenty of water, and practicing good bladder habits. Medications may be prescribed to manage pain, relax the bladder muscles, or reduce inflammation. Pelvic floor physical therapy can be beneficial for individuals with pelvic floor dysfunction. In some cases, topical creams or medications applied directly to the urethra might be used to relieve pain or inflammation. In rare instances, surgical interventions may be considered, but they are generally reserved for cases with specific underlying anatomical abnormalities. Since the exact cause isn't always known, prevention focuses on managing potential contributing factors. This includes avoiding known bladder irritants, practicing good hygiene to prevent UTIs, and maintaining a healthy lifestyle. For those sensitive to chemicals, using fragrance-free soaps and personal care products may be helpful. Pelvic floor exercises can also strengthen the muscles supporting the bladder and urethra. The prognosis for urethral syndrome varies depending on the individual and the underlying cause. While there's no cure, symptoms can often be managed effectively with a combination of lifestyle modifications, medications, and physical therapy. Recent research is exploring the role of nerve sensitization and inflammation in the development of urethral syndrome, leading to potential new treatment targets. Studies are also investigating the effectiveness of alternative therapies, such as acupuncture and biofeedback, in managing the symptoms of this challenging condition.